It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
That is exactly right, Candace, including our first doctor. It is Dr. Chad Stevens.
A little over 2 years ago, I was coaching my daughter's basketball team. Didn't like the way the drill that they were doing, so I kind of jumped in the middle of it and showed them how to do it. I'm not as young as I used to be. So the next morning I get up and I've got this severe back pain. And I thought, well, I just pulled and strained something, it wasn't any big deal. A month later, I'm still in pain, thinking this is just really kind of strange. And we went and had an MRI done, and it didn't show anything that they could see.
Some very good doctors in the Metroplex had been taking care of him for a related problem of his hip. As I started examining him and talking with him, I realized that there was something going on in his hip joint itself.
He pulls the MRI up on the computer and says, yeah, we've got some kind of a tumor that had caused some weakening in the bones. There was a fracture there was a tumor, and it was an ugly mess.
It's one of those hip cancers that is eating away at his pelvis and eating away at his hip, and just weight bearing alone, walking, could cause a hip fracture, a pelvic fracture that could put him into extreme pain and extreme need for surgical intervention. Here's this guy who walked in on his own and who thought, well, I'm just getting another shot like I've always gotten, and now I'm telling him, you can't put any weight on this hip. You've got to go on crutches until further notice. You really need to go to MD Anderson. This is an MD Anderson type problem, and he did, and he went down there and he had surgery.
I went and had a hemipelvectomy, and they remove half of your pelvis out with an allograft. So they put somebody else's pelvis in me, gave me a hip replacement at the same time, 16 hours worth of surgery, 3 hours of plastic surgery. It was a pretty major ordeal.
He had a line in for an IV so he could get his chemotherapy, lost all of his hair, lost a lot of his weight, and just went through this journey that he didn't know if he was going to survive. I think he's the only 2-year survivor of this type of cancer without a recurrence that's known.
In combination of what the doctors do, hats off to Dr. Stevens, taking the first step to find my problem, get it diagnosed correctly, and then find the proper treatment.
Now he's back, family man, coach, dad, businessman, and back to himself again.
A number of things have sort of developed in dermatology over the last year and a half that have been very exciting that relate to what we do here at our laboratory. For malignant melanoma, which we diagnose many of those here each and every day, is that there are actually new drugs now that can treat melanoma, and that's something that we've not had at all for many, many years. One thing that we're doing is sending these tumors off to ensure that that marker is present. If it is, and the people are eligible for treatment of this very new, exciting drug. We make the diagnosis of the basal cell, and then once that's made, then if it's one of these terrible cancers that can't really be treated with surgery or even radiation, then they will be eligible for this new drug. We play a vital role here in making diagnoses of skin disease, but we interface a lot with dermatologists and non-dermatologists too, plastic surgeons, general surgeons, in recommending treatment options, not just medical treatment like drugs, but also surgical treatments and even other relatively new treatments, one of which is now radiation therapy that's being reintroduced back to dermatology. There's a fairly new device that's just recently been developed that's a small X-ray device that dermatologists can use in their own office and actually treat skin cancers. Years ago, that used to be the #1 way that skin cancers were treated. Now, most of them treated with surgery, but there are some patients in select cases that are good candidates for radiation. And we can look under the microscope and tell the doctor whether that cancer is going to be a candidate for radiation if they're not really a good surgical candidate. Labs like this one play a vital role in determining the diagnosis of these types of cancers, not only melanoma, but basal cell carcinoma, many other things. And we're now interfacing with labs that do genetic testing, and then getting more personalized medicine where you get a diagnosis, you see what the cancer's genotype is, and then you can decide whether there could be a therapy that can be tailored to that individual person. So this is an exciting new development that we're going to see happening more and more in medicine.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. For more information on any of the doctors you've seen on today's show, be sure to visit our website. It's bestdocsnetwork.com. Now let's check in with our next best doctor. It's Dr. Paul Worrell.
It seemed like from earlier years, my allergies, I had just a few. And then as I got older, I was accumulating more and more allergies, or more and more things were affecting me. The allergy headaches, the sneezing, the nose running. So I went to Dr. Worrell to see what we could do. I've been on all kinds of medications, over the counter, and then on prescription medications.
Over-the-counter medications are available, and then we have prescription antihistamines, and we have nasal cortisone sprays that we use, and other medications that oftentimes are adequate for taking care of allergies that occur just occasionally. And when people are happy with that approach, then I don't think desensitization is necessarily the way to go. But if they've been frustrated by feeling like those were inadequate approaches, then we can go ahead and proceed with that.
So we decided that I needed to go on allergy shots. I chose that path, and I'm glad I did. We decided that I would go on the immune therapy December 2012. The goal is that I will, most of my allergies will be taken care of. There will still be some that there's going to be a little bit of a reaction to, but they haven't been affecting me like the other ones were.
Questions are given to determine that they are good candidates for testing and desensitization. And then they proceed with a procedure that takes about 30 minutes. And during that time, the 48 top allergens in the area are tested on skin testing. The results are measured out, and the determination is made whether they're a good candidate.
My treatment plan is a 12-month plan, and they've already made up all of my serum for me to take, and they refrigerate it at Dr. Worrell's. They hand it out to me as they check my progress and make sure that I'm on track.
We're looking at taking care of those people who have particularly profound allergies, or the allergies that just make them tired and give them the headache that they've had in the past.
I've known Dr. Worrell for over 30 years. His methods are fantastic. He doesn't just refer you to another doctor to get something treated. If he can treat it here, save you some money, he does. He's been the most fantastic doctor I've ever had.
My migraine started March of 2009 from a faulty spinal tap, and right from there, my migraine never went away. I've gotten many treatments, a lot of medications, and I've seen countless doctors, and I just didn't get any relief. My mom and I went to Dr. Reed, and he felt like I was the perfect applicant for this stimulator.
I remember when Andrew came in for the permanent unit, we had to decide which side to put the battery on. It goes in the upper outer kind of rear gluteal region. Andrew wanted it on, I believe, the left side. Because he's a baseball player, he slides on his right side, so he wanted it on his left side. Which brings up an excellent point about the stimulators. There's no restrictions. Here's this very active young man, baseball player, sliding left and right, and no problem. He has done absolutely fine with the stimulators.
So I got my permanent stimulators implanted, and they put a little battery right at the hip, and it runs up your back. And I have 2 leads on my back, 2 leads on my temples, and 2 leads right here. And I'm able to control the frequency and the intensity of the stimulation with a remote. It's amazing what Dr. Reed has done, and I'm so appreciative of him.
He came back recently having lost a lot of weight. He lost so much weight, the little battery had gotten more superficial, and I needed to replace it a bit deeper in. But he was doing great with it. He's looking forward to going to college up at Texas Tech in a year. Like a lot of patients, he's done very, very well. I think it's safe to say that it's changed his life, certainly changed it for the better.
I don't care about having these batteries and these wires inside of me. I'm just so happy that my migraines have gone away. It's amazing what Dr. Reed has done.
Vincent's severe back pain kept him from playing the game he loved, soccer. That is until he met Dr. Robert Miles. To find out more about Vincent's story and other life-changing stories, log on to bestdocsnetwork.com.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the website. It's bestdocsnetwork.com, bestdocsnetwork.com.
And now we're going to check in with our next best doctor. It's bariatric surgeon, Dr. Philip Swanson.
Kristen came in to see me. She's just a ball of energy. And she's a 21-year-old girl who just wants to be active and healthy. Unfortunately, she has the genetic makeup where she's been overweight all of her life.
This Friday I'm having my surgery, and I could not be more excited. and I'm ready. I trust Dr. Swanson, and I'm really comfortable with Dr. Swanson. I'm really excited to do this, and I can't wait. I wish it were tomorrow. I'm really excited.
This is an object in health, and that's what she's really interested in. She wants to be able to go hiking. She wants to be able to run. She wants to be able to go down a water slide. She wants to do all of these active things that normal 21-year-olds do. That's her reason for doing this. The object of being more healthy, of being able to be more active, to live a longer life. That's what it's about. It's not like she hasn't tried like every diet known to man and tried to exercise, tried all the things that you're supposed to try. So she's not had success with that. We should condemn her to continuing to be overweight for another, how many years? As an adult, if you choose to be healthy, I think you should be given that choice. You should be allowed to make that choice.
After the surgery, I'm really excited to feel comfortable in my skin. After the surgery, I'm really excited to go to the mall and buy clothing from any store I choose. After the surgery, I'm really excited to ride any ride that I can because I'm not over the weight limit. After the surgery, I'm just excited to live a normal life as someone in their 20s and not feel embarrassed or ashamed or alone. Just after surgery, I'm excited just to be me, to be who I want to be.
Cholesterol is an important thing. You need to know your cholesterol number. Now, there are 3 numbers when it comes to cholesterol. There's total cholesterol. That's important for diagnosing whether you have a problem or not. And then there's HDL cholesterol. That's the good cholesterol. You want that to be high. If you're a man, you want your HDL cholesterol to be above 40. And if you're a woman, you want your HDL cholesterol to be above 50. Now, the LDL is the bad cholesterol. That's the most important number to know because that's the one that predicts your risk of heart attacks and strokes. For example, your LDL for most people should be less than 160. Now, if you have certain diseases like hypertension or diabetes, or if you're getting older, then you really want it to be 130. That's the LDL, 130. If you have certain diseases like diabetes plus hypertension, then you kind of want to look at a number that's under 100. Now, if you have heart disease or have had a stroke or have significant risk factors in your family, for example, for early heart disease, then you really want your LDL, that's the bad cholesterol, to be less than 70. So know your number. Your doctor can get it for you pretty easily.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
My experience has been a 12-year journey. I've had 13 ESIs, which are epidural steroid injections. I've had an L5-S1 disc replacement, and it just never seemed to help with the pain that was radiating down my left leg. It even caused where I would trip and fall. I had a lot of problems with helping out with my kids, lifting my kids, being a mom.
It was decreasing her ability to work, decreasing her ability to socialize with friends and family. She had started to not be able to do the mundane tasks of life.
Dr. Duclair had asked me, well, what do you think about this device? And he kind of shows it to me. I said, well, what is that?
A lot of patients will qualify for a device, what we call a spinal cord stimulator. And that is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. And that is a great way for patients who have had surgery and are dissatisfied, or they've had injections and medications and they're still dissatisfied. Those patients can get really great relief, and they can ultimately decrease their pain for a long period of time, on the order of years, and then decrease their office visits with their doctor. And become very, very satisfied and very happy with that.
I have a little remote control device. I can turn it up, I can turn it down. I like the fact that I'm in control of it. I have pain freedom now because of the device.
Amy did really, really well. She has total pain freedom. She does not see me anymore in the office because she does not need to. She's not taking any medications. She essentially has no more complaints of back or leg pain.
I'm just very blessed, very, very blessed that he's in my life, because without him, I don't know that I would have the pain freedom that I have today. So I believe that God puts people in their life for a reason.
For more information on any of the outstanding doctors you've seen on today's show, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Right now, it's time to head to our next best doctor. That is PAMA physician, Dr. A.L. Shaw.
Woke up one day about 13 years ago and couldn't stand up straight. And after seeking medical attention, sort of a variety of ways, one of the doctors I saw suggested I come see Dr. Shaw.
When we examine scars, I simply take something such as a PDA stylus that is very blunt, allow them or stimulate a non-scarred area remote from the area with the scar, so they know how this particular stylus feels with the amount of pressure I'm generating. When I touch the scars, quite commonly they are numb. They don't feel them at all until I hit an area of nerve entrapment. And those areas we mark with a skin marking pencil, and those are the areas that we inject deeper than the skin, and then we also inject the entire length of the scar.
As you move away from your surgeries in time, you find that there's sort of a new sort of pain. After you heal from the surgical pain and you get back into your daily life, you find that there's some new kinds of quirky little aches and pains and bristly things going on, and it can be scary. At first you can think, oh, my problem has returned.
Relative to her scar pain, really did achieve pain freedom. She has other problems that are still generating pain from her spine, but even that's much improved, not from the other therapies that we've done, but just from the scar injections.
It's comforting to have Dr. Shaw on my side, to know that it's his goal as well as mine to bring me pain freedom, and we work at that together, and I think we're doing a good job.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
We are happy to welcome to the Best Docs Network in the studio. This is Dr. Ed Singleton, podiatrist Dr. Ed Singleton, one of the best in the Dallas-Fort Worth area. Over 25 years of experience. He's your go-to guy when it deals with foot and ankle and also tarsal tunnel syndrome. Explain this as far as what people may be experiencing, the symptoms with tarsal tunnel syndrome.
First, thanks for having me today. Tarsal tunnel syndrome is a condition that's very similar to carpal tunnel syndrome in the wrist, and everybody's heard about that. It's a very similar condition that affects the nerve that goes behind the ankle and down into the foot. There's different things that cause it, but the bottom line is there's a compression on the nerve as it passes behind the ankle joint and goes down into the foot. The symptoms range anywhere from burning sensations, cold, numbness, zingers that go out the toes. People have told me it feels like fire shoots out the tips of their toes. It's sort of like hitting your funny bone.
Right.
and it affects the foot, the arch, and out to the toes.
I know a lot of people out there watching have experienced those symptoms. Now, Dr. Ed Singleton is the only one in North Texas that can treat that type of problem with a minimally invasive procedure. Explain that, doctor.
Well, I'm fortunate that I've been trained by Dr. Steve Barrett, who developed the minimal incision technique for the tarsal tunnel. Most people will approach a tarsal tunnel surgical release with an incision anywhere between 2 to 3 inches and 5 to 6 inches long, depending on how large the person is. That exposes the entire length of the nerve so that you can decompress all of the structures that squeeze on it. The approach that I use involves incision approximately 1/2 to 3/4 of an inch. That incision is placed behind the inside ankle bone, and the benefit from this is usually a much faster healing rate. Usually you're on your feet much faster, and usually you have a significant lesser amount of pain than you would with the standard open technique.
There you go. All right, Dr. Ed Singleton, providing pain freedom to your feet. Appreciate it, doctor.
Thank you so much.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I had a bad problem of grinding my teeth, and 30 years ago I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth looked like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in all of the Dallas-Fort Worth area that are helping to change people's lives.
And for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment for us, you know we want to hear from you. Send us an email at info@bestdocsnetwork.com.
And good news, Candace, the Best Docs Network magazine, soon to be out, so check your local newsstands. So long, everyone. We'll see you next week.